So critical things with colostrum, we have to have colostrum in a timely fashion. So these babies are only able to absorb it in the first 24 hours. Really, their ability to absorb it changes honestly after about 6 hours. So kind of one of my rule of thumbs is that we need to get colostrum into them within the first 6 hours, if not less.
Welcome to MeatsPad. In collaboration with the American Meat Science Association, it's a platform dedicated to share breakthrough knowledge that is accessible to the global meat industry. On each episode, you'll have the opportunity to listen and learn from meat specialists and professionals about the whole meat industry. This podcast is brought to you by the U.S. Meat Export Federation, Ultrasource, equipment and supplies for the meat and food industry, EFA, slaughter and meat processing tools.
Hello, meat folks. Welcome back to the MeatsPad podcast. This is your healthy and hungry host, Phil Bass, joining yet again with a colleague of mine who is actually going to help us with a question that we had from some of our listeners about, well, we'll get into it. First off, let me introduce Dr. Lauren Christensen. Dr. Lauren, thank you so much for joining today.
Cheers. Thanks, Phil. Glad to be on.
Yeah.
Cool.
Okay, so you and I were visiting, and I had a question from one of our listeners, and this is a little bit different, considering we do a lot of discussion on meat processing and harvesting and fabrication and all those kinds of things, and this is actually a lot more on the live side of things. And so, for those listening, Dr. Lauren Christensen is a doctor of veterinary medicine, and is part of the faculty at the University of Idaho, and has some great background and experience. And we'll get more into that, but we need to get to the questions first, of course. But great background and experience with cattle, with livestock, both dairy and beef. And one of our questions from one of our listeners was, can we talk a little bit about calf mortality? It's not a super cheery topic, but it's something that we probably need to discuss, especially if we do have that question, because ultimately, livestock health will ultimately impact the ability to harvest meat, but then also the quality of that meat. And so, first off, maybe give just a little bit of background on what is important as far as maintaining health of calves. We're going to focus on the cattle industry today. So what are some of the things that are important for our listeners to know about in maintaining health and maintaining the lives of our young cattle population?
Sure. Thanks, Phil. So I think one of probably the most easily overlooked, but also low-hanging fruits on this topic, and I guess your question didn't really specify. Is this baby calves that we're talking about? Like
baby calves.
Around baby calves, not weaned calves. Okay, we're talking about baby calves. Okay. Yeah. I guess one of my things I really try and focus on, and also doesn't matter if we're talking about folks that have 2 cows in the yard, they have 2,000 head that they're milking, whatever kind of situation it is prevention goes a long way, right? Mm-hmm. That's a super low-hanging fruit. And whether we're talking about just basic farm biosecurity, or we're talking about putting in just general hygiene management type protocols, prevention is going to be a lot easier to deal with, and something that if we don't have appropriate prevention on board, as a veterinarian, I question, how much on the opposite end can we do, right? If I am not doing kind of the basics as far as hygiene, managing the health on a preventive standpoint, my hands are kind of tied with what I can do as far as treatment, vaccines, et cetera. So we're talking about prevention. I guess my first one is farm biosecurity, kind of knowing where our animals are coming from, limiting mixing as best as possible. It's one thing if we're trying to get bucket calves from a dairy, kind of knowing what the background is if we decide that we're going to raise them as bucket calves for a project. If we are, getting animals from mixed sources, that can also lead to some issues. So asking questions, understanding where the background is, and then also trying to make sure we're minimizing cross-contamination. So again, doesn't matter if this is bucket calves, we're talking about beef calves that are out on pasture. Certainly, we want to be washing our hands in between handlings, washing boots, all that fun stuff. And remember too that you too can get the scours, and maybe we'll touch more on scours in a little bit, but You know, a lot of these things that we're dealing with, bacteria, viruses, parasites, are transmissible between animals, as well as to other species, including people. Also on the prevention deal, let's not forget about the cow, right? So that cow was pregnant for 9 months. A lot of changes during that time frame. You know, just in a normal situation, maybe she was moved around, maybe she was purchased, maybe she came off mountain pasture. But making sure that she is in the best health that she can be in while she's pregnant with that calf, up to date on her vaccine, she's dewormed, she has appropriate mineral in front of her. Nutrition is well provided for in that last trimester, especially for gestation. That's going to help give that calf a good kind of footing as it actually comes out, right, during parturition in those early stages. So prevention on that end. Another thing that I like to talk about is just basic hygiene, right? So obviously some of us are blessed with really nice pastures that are south-facing slopes with great drainage, and we have tons of acreage and can move animals
and
around.
Flowers and rainbows
all our
and sunshine and everything.
And it's not too hot, it's not too cold, right? But the reality is a lot of us are calving sometime between January and whenever spring is in your part of the country. And there's a lot of mud and there's a lot of snow, and a lot of poop that's out there, right? So doing our best to make sure that these calves are born in a relatively clean environment. So trying to put them somewhere where there's some fresh bedded straw if it's super muddy. You know, is it better to be calving in mud and snow later on in the season versus ice early in the season? I have a friend in Kansas that's actually the decision they made was to move calving up, so that they're going to calve on something that's a little bit easier for them to manage versus just being in knee-deep mud, you know, in that part of the area. But also making sure that we're trying to pay attention to basic hygiene. Again, whether that's the pasture, if we're looking at feeding bucket calves, you know, whether that's dairy beef, maybe it's a 4-H product or something, washing, cleaning, sanitizing, especially if we're doing bottles, that's super low hanging fruit, and making sure that those are all clean and sanitized in between animals is going to be super critical too.
Yeah. And so, and I love these topics because this is, it applies very closely to what we talk about in the meat industry too. Is cleanliness, hygiene, prevention, so important. And something that may be less familiar to the to our meat industry listeners, however, is colostrum. Can you mention maybe a little bit about the importance of colostrum, especially with our very, well, it's really only our very young baby calves, and how important that is to the success and thriving of those animals?
Absolutely. So a quick review on colostrum. And again, so I'm here on faculty at University of Idaho, and one of the things we talk about is colostrum. And so all of our animal science students should know this, right? Colostrum is the first kind of milk that is produced by a female bovine after she calves. So she'll actually start producing it in the last couple of days or so of gestation. And it's only made by that udder, by that mammary gland for the first 24 hours, and then she'll switch to more of a normal milk. But if you're looking at colostrum, it's going to be kind of this thicker, maybe creamy or yellow tinged type fluid. And technically it's not milk. It's actually a substance that is loaded with antibodies. And so one of the weird but very interesting things that is a cow specific item, well, really ruminant specific item, is that these calves and also these lambs and goat kids, they are born without a fully developed immune system. That has to do with how the placenta attaches during gestation, but ultimately they don't have the ability to fight off any of these pathogens when they are first born. So they're able to ingest that colostrum, which is full of antibodies and immunoglobulins, as a way for them to immediately have some kind of protection, not only the lining of their digestive tract, but that's going to be absorbed immediately into their bloodstream. So critical things with colostrum, we have to have colostrum in a timely fashion. So these babies are only able to absorb it in the first 24 hours. Really, their ability to absorb it changes honestly after about 6 hours. So kind of one of my rule of thumbs is that we need to get colostrum into them within the first 6 hours, if not less. Not all colostrum is made the same, right? So colostrum varies in quality depending on the mother. And also, again, how much colostrum is going to be important too. So we can have high quality, dense colostrum that is of good quality, but maybe that calf was born with contracted tendons and it can't stand up and nurse, right? So even if it's available, we have to make sure that baby is actually able to nurse and get that colostrum in a short amount of time. So again, that window is really narrow, and that is absolutely critical. Animals that do not get colostrum often develop what we call the failure of passive transfer. And so they are highly susceptible to developing all sorts of infections, usually within the first couple of days to week or so of life.
Since 1883, Ultrasource has been a trusted supplier to the food industry. Ultrasource provides superior kill floor, processing, packaging, and labeling equipment and operational supplies.
Yeah. So, and for those out there listening, our folks that maybe have some connection to livestock, but not quite as much as Dr. Lauren and myself, you've mentioned how if they don't get that colostrum within that first 24 hours or 6 hours, I mean, this is so critical. And for so many over my life where I've had the opportunity to observe cattle and ruminants, for that matter, sheep and goats too, the ones that don't get the colostrum early on really do struggle and quite often will perish very early on, and this leads to that accumulation of calf mortality early on, and so it's such an important topic to discuss. It's such a, I would say, relatively simple preventative, but even then it's simple, but you do have that target window that is so important too to take care of. And I want to mention too, one other thing. I want you to kind of talk a little bit about another subject, because first off, would you agree that colostrum limitations or inability to nurse with colostrum, that might be more along the lines with some of our dairy calves, or maybe not so, maybe more, maybe it's even between beef and dairy calves, but then on the other side is something that you've mentioned to me and educated me on is navel dipping, and so making sure that we take care of that passageway that led into the calf while it was developing, but now is also still a susceptible location for illness to transfer. So I gave you a whole bunch to work on with.
Man. Okay. So I guess the first item you were talking about was ability to get colostrum, or how frequently do we encounter issues with colostrum?
Yeah. I mean, would we expect to see colostrum issues more so with the dairy, less so with the dairy, more so with the beef, less so with the beef, or is it kind of just a toss up, just depending on the variability that is native to cattle?
Sure. And, I think, Phil, if you asked me this 5 years ago, I'd probably have a different answer for you.
Okay.
Traditionally, I think it's kind of a toss-up at this point.
Yeah, that's fine.
Traditionally, we've seen folks kind of picking and choosing on the dairy side, right? Because we have our bull calves that are traditionally less value than a heifer calf, and maybe if we don't, colostrum is in short supply for whatever reason, or we're shorthanded for labor, obviously we're going to choose that heifer calf in a dairy situation to continue to keep as a replacement, and that bull calf may go to the wayside, may get fed out as a bucket calf, whatever it is.
But
we all know
possibly
that,
got less attention, right? Yeah, possibly got less attention. Yeah.
But these days, how much is that calf worth? And Phil, I don't know the last time you saw a bucket calf, maybe a dairy beef or just straight dairy calf. I feel like they used to be $5 a piece, and now they're a couple $100 if you're lucky.
Yeah. And that's a good point. Let's emphasize that, because for those in the beef side of things, beef cattle are going to be in short supply in the next couple of years. Surprise, surprise. We have had a large contraction of the beef herd overall, and I will say it's probably going to be the dairy industry is probably going to be our big shock absorber to make sure that we do continually have beef cattle and beef in the grocery stores. And so yes, I love the direction that the dairy is going to maybe crossbreed with beef type animals, but then also putting maybe a little more emphasis on those bull calves and trying to give that great care that they need to thrive. So great point. How about navels?
Navels, yes. Let's go back to navels, right? Right. So it's the belly button. That's your common word, right? So we're all talking about that. So belly button, the navel, the umbilicus or the umbilical cord, right? So that's going to be on the belly part of that calf. And that literally was a big vessel that was attached to the placenta and actually provided blood circulation, all the nutrients while that calf was growing, right? While it was in utero. So once that calf is born, we have some physiological changes, some fancy stuff that happens, but ultimately there's no blood flow through that vessel anymore. And we'll see that kind of dangling from the calf's belly. It's still a kind of a portal to the inside of that calf, just like you said earlier, Phil. So I am, certainly really concerned about anything and everything that could possibly travel up that. Again, these calves are born hopefully in the cleanest environment that we can provide. Right. But manure has bacteria on it, right? There's bacteria in the environment, and that's normal, right? The cleanest pasture has some bacteria on it. So we want those navels, those umbilical cords, to be treated with something to disinfect and dry them as quickly as possible. So I usually tell folks, depends on your state for regulations. The recommendation for a long time has been 7% iodine. That's strong iodine. Some states you are going to have a really hard time getting your hands on that particular product. There's a couple other products that are usually alcohol-based, seem to do okay. The other preferred product these days is chlorhexidine or Nolvasan. That's going to be that kind of blue, like surgical kind of liquid. Sometimes you can get it down at the farm store. Otherwise, talk to your vet. But we want to make sure that navel is completely soaked in this material all the way up to the skin. And then that we're not reusing whatever container it is to dip navels. Can't tell you how many places I've been on where we've got these gross, crusty containers that we're just like double dipping going down the line for all these animals, right? So spray bottle, if you can dump something on a Dixie cup that you're filling and then throwing out the extra. I've seen people poke holes in the top of like water bottles before and kind of squirt out through that. All those are going to work. But ideally that should be dried up and look like a little piece of beef jerky in about 24 hours or so. If it's damp, we need to get it dried out. So.
Sure. This is great. This is fantastic. And folks, we've had a number of people on here where we've interviewed about improving meat processing and everything. This is just kind of that additional information that a lot of our listeners don't get. They don't know this is happening, but it is absolutely critical. So we're taking good care of those calves from a hygienic perspective, making sure that those animals are being born in as clean of an environment as possible. The reality is they're born outside. Okay, that's just how it is. They're big animals. We use the outsides. They're born outsides. I am my wife and I. We're excited that it might be snowing, and thick snow, in fact, when the calves are being born. And let's be honest, these animals are pretty robust, and we do want to get them dried off. We do want them to thrive in that manner, but they can handle a little bit of that colder weather, generally speaking. You'd
be surprised. They generally do quite well in snow. Actually, they'll bed down, and as long as it's not, I get more concerned we have sleet and kind of wet snow, but
wet and rain and wind, right?
Sure. I'll pick snow over wet and rain any day.
Yep, absolutely. So hygiene importance, location, when they're being born, when they're being raised, of course, too, later on, and that's important. Colostrum, which is super important because we got to give them their immune system that jump start, and they're going to get that from the mother. and dipping navels, major importance. Now that I know, and I'm so grateful that I get to work with a veterinarian who can help me better understand animal health. As long as I've been working with animals, this was kind of a newer concept for us, and hopefully it's not a new concept for those listening. But if it is, dip those navels, make sure that's getting done. This is great, and I hope that this has kind of helped answer the question that we received about what is being done, what is the chances of calf mortality, livestock mortality. This is a whole discipline, guys. If you have an interest, really start looking into it. I know there's other podcasts out there that have animal science focus in mind, but hopefully this answered some of the questions that were out there. We also like to ask all of our guests, Dr. Lauren, how did you become Dr. Lauren? How did you get involved in the veterinary sciences? And tell us all about that.
Oh dear. Okay. Well, we'll go for some of the more abridged version.
Okay.
I'm Dr. Lauren to most of my students, but my name's Dr. Lauren Christensen, and as Phil mentioned, yes, I am a veterinarian. So my background is primarily with large animals. I grew up in 4-H. I did grow up in suburban Southern California, I will admit, but I did show animals in 4-H for 10 years. Very much will attribute a lot of where I'm at right now to 4-H. So for all the parents out there that are, carting their 4-H kids around, going to the feed store, picking stuff up, thank you.
Yeah.
Because it does snowball, and then your kid will end up like me. So
yeah.
Went to college. I actually did my undergraduate at Cal Poly San Luis Obispo. Woohoo! Go West End.
Same here.
Yep. So finished up my undergraduate degree in animal science. Ended up at Kansas State University. Go Cats! Woohoo! Out in Manhattan, Kansas for my DVM. And then ended up taking a job. I was looking for a job with primarily large animal opportunities in large animal medicine, with outdoor hunting, fishing type situation. I love the Midwest, but I cannot say that I miss the tornadoes or the humidity. So I took a job up here in northern Idaho. I was in private practice for 3 years, did mostly beef cattle, cow-calf type operations, a lot of hobby farm type operations as well. Left and went and worked on racehorses for about a year, came back to northern Idaho, and worked on a master's degree part-time while working in practice. And I briefly also worked with a local, the county conservation district. We were doing some outreach and public education on respiratory disease in domestic sheep as well as in bighorn sheep. So all sorts of fun, cool, interesting things. But I've always loved teaching, and it's really fun to be full circle and get to work with students here. So working with students here at the University of Idaho, and then vet students here at Washington State University too.
Yeah. Well, we thank you for all that you do, all your service to the community, to the academic community, especially for the students that get to chance to engage. But then also, you're a great resource for us animal scientists who are more in the research, classical academic side. And I'm grateful for having a chance to visit with the veterinarian regularly. We have another veterinarian on staff as well. For those out there listening, go and talk to a veterinarian. You're going to learn a lot. And there's always a way to apply some of that learning that you're doing. And hopefully one day I'll get a chance to bring on a USDA veterinarian, maybe too, that helps with animal health at the slaughter side. But this was to answer a question from our listeners. Folks out there, keep sending those questions in. It's info@meatspad.com. And with that, Dr. Lauren, thank you so much for joining us today.
Cheers. Thanks, Dr. Bass. Appreciate it.
All right. We'll see you around.